Yep. And for some reason, Brooke Perkins signed up again to do this. So I'm going to admit both of them. So they're coming in now.
There he is. There's Dr. Purdom.
Okay.
So everybody's here, Pat.
All right. We'll call this meeting to order. First item of business is public comment. We have two people who are signed up. The first one is Brooke Perkins from Smithville.
Are you going to read the rules for public comment, Pat?
I didn't pull them. Sorry. I don't have my sheet, Gary. I'm sorry. I can't put my hand on it right now.
All right, so all of our guests, they will be given 3 minutes to address the board. So what we'll do, we'll put up a timer as soon as that starts, and you'll have 3 minutes to address the board and on the topic that you wish. Since we have multiple attendees, it shouldn't be much of an issue, but try not to repeat much of the same information or topic if possible. But at the end of 3 minutes, your time will be up. If you continue to talk, we'll go ahead and mute and move you back into the attendee role. So we'll start with Brooke. What I'll do is I'll promote you on our side, and then you'll be able to unmute yourself, and then you can address the board when that happens. So just wait 1 second.
Thanks, Daryl.
I just want to check. Can anyone hear me now?
Yes.
Yes, Dr.
Yeah,
Knight.
that's nice to hear you.
Thank you. Had some difficulty logging in.
Okay.
Oh, sorry about
So Brooke, you should be ready to go.
Can you hear me?
Yes.
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 Okay, thanks. So I just wanted to talk about the test to stay option that's listed in the meeting. I don't know the exact proposal that will be presented, but I did research some others that have been implemented in similar programs in surrounding areas. And so I just want to talk about the option for test to stay could potentially require multiple testing of our children on multiple days to remain in school, and even additional testing, participate in sporting events if that is part of what her proposal is. I just think that this can create situations where children are testing too often, which the testers are uncomfortable experience to begin with. I feel like it'd be a waste of resources and funding that could be better spent on education, whether that be supplies, lunches, bus drivers, teacher retainment, etc. Many schools don't even accept the rapid test results as a valid option, and they require PCR testing results instead. So that would eliminate the ability to test before activities or anything like that, or same-day testing, or even the option to test multiple times per week, like the proposal might examine. Waiting for those test results, I think, would cause a lot of unnecessary delays and a lot of added stress to students and staff who are already struggling through the dizzying and many times nonsensical requirements just to stay in their position or in their schools to get their education, while communities outside their school buildings continue to function at a mostly normal conduct. The quarantine guidelines work against the students and take away valuable education time. And currently at our school, 96% of the quarantine students never even develop symptoms or test positive. So we just can't keep subjecting our children to never-ending testing and keep these healthy children from getting the education that they're entitled to. And we should not force them into situations and masking that outside of the school they are not subjected to, and neither is the rest of public. So I think people should be trusted to manage their health and the health of their children. And if kids are sick, keep them home. If they're positive, then they should quarantine until symptoms are gone and return to normal activity. Healthy students and staff who are not exhibiting symptoms should not be cut out of their activities, classroom work, and be subjected to regular uncomfortable testing and stress. I think we should be working to keep kids in school and people at work comfortably, and not creating more obstacles and hoops to navigate just to participate in our daily lives. And that's all I have to say. Thank you.
Thank you, Brooke.
I'm sorry, it's Dr. Purdom. Did we hear where Brooke's name and her community she's from?
She's from
Yes.
Smithville.
Sorry.
Okay.
Yeah,
The
I'm
next-
sorry. I'm from Smithville.
All right, thank you very much.
The next presenter is Whitney Carlisle, and they also are from Smithville.
Brooke, I'm going to move you back down to just being an attendee. Okay. Okay. And Whitney, I'm going to promote you up here. Okay, Whitney, you should be able to unmute yourself now.
Okay, can you hear me?
Yes, thank you.
My name is Whitney Carlisle from Smithville. I'm a mom of 4 children ages 1 to 11. I'm asking you again to please make the necessary changes to your quarantine guidelines for schools. Our school district has had 723 students quarantined this year. Of those 723, 23 went on to test positive. That proves our quarantine policy, based on your recommendations, is not effective. Today, my daughter was one of 7 kids in her class who made the cut to stay at school. As a 6th grader, she was left looking around, wondering how that made any logical sense. Yet, this is the policy adults and experts have come up with. Kids are sent home all day by themselves, parents scrambling to figure out what to do with their children, teachers left to pick up the pieces and try to help the kids. Whether you want to hear it or not, these children are then also still playing and interacting with each other outside of school, thus negating any quarantine benefits. Tonight, you all will be voting on a test to stay policy. Let me tell you, as a mom of 4 young kids, I will not make my children get COVID tested 3 times in 1 week just to be able to attend public school. Also adding the possibility of daily testing to participate in extracurricular activities. This is nonsense and parents are not going to stand for it. Imagine a little 1st grade child being required multiple times to get COVID tested just to stay in school, to be with her peers. What kind of mental torture do you think that will have on a child? As a mom of young kids, I know it would be awful. Kids are already suffering mentally due to all the effects COVID has had on their lives. Please don't add yet another thing for them to deal with. As our health department, you thought it was best for students to stay home last year. You were wrong. We know how detrimental no or little in-person learning was on kids and teens. You think masks aren't affecting our children. I can assure you, as a mom and substitute teacher, you are wrong. You think sending healthy children home from school for 7 to 10 days is what is best for them. You are wrong. Now, I'm assuming that with what will be presented tonight, you think testing them over and over for something they show no symptoms for is a good idea. I can promise you will be wrong again. Parents I know will not stand for this in a public school setting. Teachers and staff can also not take on another thing. A simple guideline of if a student is sick or tested positive, please stay home would do. Let's not overcomplicate it or make a bad year worse for our kids. Ronald Reagan said, quote, "Government is not the solution to our problem. Government is the problem." Parents want you as our local government to stop interfering with our lives. You've done enough the past year and a half. It's past due to let families have control of their lives. Thank you.
Thank you, Whitney.
Okay, Whitney, I'm going to move you back down to an attendee here. All right, and Pat, I'm going to check just one more time. And yep, that is everybody. So we only had two public individuals addressing the board tonight.
Okay, I'm going to close the public comment section then. Our next agenda item is monthly board education session. Who's doing the test to stay option for schools? Is Ashley or?
Hello, everyone. Yes, I am going to present the test to stay option. So I will just start off by saying because you all have the document, I'm not going to dive deep into all of the ins and outs. I am just going to pull out some highlights. So since the last board meeting, DESE and DHSS have come out with their criteria around the test to stay option. What we have done since DESE and DHSS have provided their guidance is we have met with all of our districts, and we've also met with other local public health agencies to really determine how other agencies are planning to roll this out in their jurisdiction, and to determine if our schools are interested, and if so, how they would potentially use that option. And so after receiving that input, we have put together the document that has been submitted to you all in the board packets. It is an exact replica of the Jackson County's version of test to stay. So we hear over and over again, specifically from schools, it's really difficult when jurisdictions have, you know, slightly different guidance. It's really difficult for us to implement when we have students that are living in one jurisdiction and going to school in another. And so in order to create that continuity, we are proposing to adopt Jackson County's version of test to stay. And I do believe there are other jurisdictions that are looking, if they haven't already, to adopt this similar version. So I want to emphasize, sorry, yes, go Gary.
Kansas City, Missouri also.
Okay. Yep, I was thinking them. Yes, so we've got 3 jurisdictions in the region that are looking to either they've already adopted or looking to implement this version. So I want to reiterate that this is an option, first of all. So this is not something that's going to be required of schools. And in fact, not all of our districts are interested in implementing, but some of them would be. And so we're wanting to at least open this up as an option. And then another very important part of the guidance that we have written up is that it also does require consent. So parents have to opt into this option, and if they are not interested, then they do not have to participate. So a couple of areas that are a little bit more restrictive than what DESE and DHSS set out that are in our document. We are requiring that in order to participate, in order for a district to participate in this program, they must have universal masking in place. And also, in terms of the number of tests that would need to be conducted to be eligible or to meet requirements for this program, we are requesting daily, or we are requiring daily testing for every school day, which differs from the state guidance in that they are requiring a minimum of 3 tests within the first 7 days of quarantine, and we're requiring a test on every school day. If there are extracurricular activities on the weekends, we would also be requiring tests on those days. So in a nutshell, that's the context around the document that has been brought to you all, and I'm happy to answer any questions that you might have. Gary, is there anything else you would want to mention?
No, I don't think so, Ashley. Again, want to emphasize that this is not a requirement. This is just another option for schools to consider. Schools can consider to do it, or they can not do it. It's their choice. And it's also important to note the parental consent piece as well. So this is not a mandate or a requirement. It's just another option for schools to consider. And if they want to do it, they can do it. If they don't, then they don't.
I think Dr. Purdom, you have your hand up.
Yeah, I was just going to ask, is there, at some point, we're going to have to start trusting the vaccine in terms of efficacy, and this doesn't seem to have any, we don't differentiate between immunized versus unimmunized students. Do you want to speak to that a little?
So yes, and that's really foundational. So in the state guidance, it really talks about who is who would be considered a close contact and who would not be considered a close contact. So if somebody is immunized, they wouldn't be identified as a close contact and we would not quarantine them. So they wouldn't be eligible for the program.
Kathy?
Yes, I just want to, Ashley, I know we've spoken before about this Test to Stay program, and just for the good of the group, if you might want to share about some of the things that you've shared with me, that you guys have really done a lot of good hard work on this and just looked at and talked to the folks in Kansas, and to learn that most schools that adopt this are very small districts, because larger districts just simply don't have the manpower. They don't have the resources. It's a huge logistical challenge to do Test to Stay internally in a school district. But that the folks in Kansas you spoke with in the neighboring school districts just had said that outside sources are needed to be able to run this Test to Stay program. This is not something a school district can do. Is that kind of summarize it, or?
Yeah, so really, I mean, we've heard from all of our districts, and if at most of our districts, if they were going to implement, they would either need to have a third party to contract out or hire staff. And so really from our standpoint at CCPHC, we didn't want to limit, and if the logistics don't work out on the school end, that wasn't something that we wanted to make the decision. We didn't want to make the decision for them. The guidance and the background that is presented is something that is sound from a science standpoint. And so if schools want to adopt based on the criteria that's set, they can. If they don't want to, they don't have to.
Mm-hmm. Yeah.
Dr. Gates. Oh, sorry.
Well, just my only other comment is that just by virtue of the county health department just recommending this or having it out there as an option, just seems it puts a lot of pressure on school districts from some entities of the public to have to then try it or whatever. But yeah, it's just a lot of, it's a pressure inducing type of thing when we know logistically it's not feasible, and it's very, very difficult on students as well as staff, and just the many challenges of this program.
Kathy, do you feel like what the schools are currently doing is successful?
Yeah, absolutely. It is highly successful. Our data shows that. And again, like I would echo like some of these parents that have talked, like the kids that we're sending home to quarantine, they're not turning up positive. Like we're just not having, it'd be nice to jump to, like, I know, the rigor of the Test to Stay is not feasible, but we already have data showing that unless these kids are positive, some of this quarantining is just, it's not necessary, quite honestly, right? We're just not, our data is not supporting that all these kids are not having these kids turn positive. We are exercising the option for parents to come back, for kids to come back on day 7 or on day 8 if they get a negative PCR test on or after day 5. So they can shorten their quarantine. That some families have opted for that, but yeah, we're hopefully CDC and others can get to the point where we're getting to where we handle this as a usual communicable disease eventually, and quarantining only those who are positive and symptomatic, and not sending a whole lot home like we've been doing, because our data is just showing otherwise.
Okay. Dr. Gates?
Yes, I had a couple things. The first is, I think that our recommendation should be consistent. And the recommendation, if I recall from the document that we put in place in August, was that we strongly recommended masking. And this document says that we will mandate masking. So if the schools are to choose this, that we are then recommending, not recommending, we are mandating it. So I have a problem with us saying two different things, and that's my first concern. So I don't know if anyone else has any questions on that before I go to my second thought.
Well, Dr. Gates, I can clarify that this is a fourth option for quarantine. So there's already 3 other options available. And so in order for schools to participate in this fourth option, we would require that they have universal masking in place. If they don't have universal masking in place, then they would be limited to the first 3 options of quarantine.
Now, this fourth option, though, from what I understand, you're saying that the requirement for masking deviates from what the DHSS said. Is this something that was put on locally?
That is more restrictive than the DHSS guidance, yes, and DESE guidance.
So what does the DHSS guidance say?
The DHSS guidance does not require universal masking for this fourth option.
Okay, and so why would we have to put that in there as a Clay County Health Department?
So this essentially opens up the window for, Gary, do you want me to answer this, or do you want to, Gary?
Yeah, go ahead.
Yes. Okay. So essentially, what this opens up is a window for schools to move away from universal masking, but still have the opportunity for exposed students to be in the classroom. And with the test that is going to be administered, the Binax Now test, which is from a manufacturer standpoint, not recommended to be used with asymptomatic individuals, is the test that will be utilized to determine if somebody is positive on a day-to-day basis. And so from the testing perspective, we were not super comfortable with the results that would be obtained on a day-to-day basis and call it safe. And that was the feeling that several epidemiologists from other regional, other health departments within the region and outside of the region also concluded. And so that's why it landed in there for the Jackson County guidance, and why we chose to propose it that way as well.
Now, are you requiring, is this mask mandate for all students or just the students that are being tested?
In order for schools to use this option at all students would need to be masked.
Okay, yeah.
Because it isn't a replacement for masking. It is an additional option for students to be exempt from quarantine.
Yeah, personally, I would be in favor of going with the DHSS guidelines, which do not require mandatory masking for the schools that would have this, so that it would be consistent. We could say highly recommended, just like we have in our other document, but I would like to remain consistent with our recommendations for all 4 options.
That's going to be difficult, I think, from a school district standpoint to conflict with Jackson County and KC-Mo and that guidance. It's going to throw in all kinds of confusion. And I think the universal masking linked with the test to stay, that is, if we adopt the test to stay. That link is, that's I suppose the option to, let's say there's a Vax to stay effort, right? What we're talking about unvaccinated folks that want to have the option to stay in school. That's what we're talking about here. And so, yeah, I don't know. It's a hard inconsistency for districts to have to navigate when we have schools in both jurisdictions. It makes it not useful.
And that was my question. I just need to clarify. So Kansas City, Missouri School District has adopted this, or Kansas City, Missouri Health Department, I should say, the city health department, they've adopted these same guidelines. Is that correct? Okay, so for Liberty Schools, for instance, you could, if we don't adopt this, for Liberty Schools, you have kids outside of Kansas City, Missouri, following one set of guidelines, and you have kids inside Kansas City, Missouri, but still part of your school district, supposedly following a different set of guidelines.
That's correct. It throws in all kinds of confusion.
Okay.
The attempt to universalize it to our area without having all this confusion is, yeah, very helpful.
So I would point out that it's as a management team, it's our responsibility to bring these issues to the Board of Health for this kind of healthy discussion. And so you certainly have a number of options in front of you later on when you vote on this. And one of those options would be to vote to not adopt the test to stay program. So I just want you to keep that in mind as well.
That's probably where I'm at. Just saying.
One other thing, when we put recommendations in place, I think that, as Kathy stated, we really don't want to burden the schools and force policy on them. And in this situation, there are many activities that occur on the weekends, all sorts of, whether it's band or anything, sports, and the schools will definitely not be open for testing on Saturday and Sunday morning. And even over, like, if there's a holiday basketball tournament on Friday, Saturday, Sunday after Christmas. So my concern is if we're going to recommend this to schools, then we as a Clay County Public Health Department ought to have a solution for that. And if that's opening up the Clay County Public Health Department on Saturday and Sunday mornings to test, or the weekdays that are not that schools are not open, we need to provide an avenue for the students to get tested between 6 in the morning and 8 in the morning before the cross country meet at 8:15 a.m. We can't simply say, this is an option for you and figure it out. And we know you don't have the staff and no one's at the school to get this tested. So I think that if we're going to recommend things to the Clay County Health Department, we ought to have a plan for implementation. And I think that's where Kathy was getting at, is there's no way right now that this plan can be implemented. So I have an issue with trying to push things through that we don't have an implementation plan for, and just make it the school boards to have to figure this out. And the other is a recommendation that's inconsistent with our current policy regarding highly recommending masking and mandating masking. And I know that, yes, their Kansas City Health Department has done one thing, but perhaps if we were to revise it and say we highly recommend, maybe they would have to change their policy. So I'm not saying that, we're not voted in by the people of Kansas City that are in the Kansas City Health Department. So we can have different opinions. I understand it's difficult in the school district that has schools in different jurisdictions, but it's not to say that our highly recommend is not right. It may be that mandating things is not right.
One point to add around the sports testing is that that guidance has not been altered from the state guidance. And so that was not more restrictive. That is just on par with DESE and DHSS.
And if I remember too, on that sports guidance, there's a mask requirement for the athletes while they're in quarantine and test to stay. They have to wear a mask. And again, I feel that's just completely not even feasible. Like, I don't know what cross-country kiddo or football player or basketball player is going to be exertional and wear a mask. And so that DHSS guidance, when I read that, again, not a fan. It's just not this whole thing. I just don't feel is really feasible and workable in a real life situation or just from day to day and for these districts. Just my thoughts.
Kathy, I'm with you. I agree. When I read this, my issue was it was so complicated and there were so many tests that people were going to have to do. My thought was, who's going to track all of that and who's going to keep track of when somebody needs to be tested and when they don't, and then how are they going to be tested and who's going to do the testing? I felt like there was a lot of I don't know, just complicated processes and procedures built into the system. I was concerned that it was not a workable system. Dr. Purdom, I'm sorry.
No, I mean, I the masking issue, I'm a little less worried about. I mean, I've said before, the Liberty women's volleyball team won a state championship wearing masks start to finish. So I'm thinking if those young women can do it, probably about anybody can, and I do think part of this, unfortunately, is a discussion about, let's be honest, this is a workaround because, people aren't listening to what should be our primary message, and that is get your kids vaccinated. I've had my vaccine. I've had 3 doses. My kids are all vaccinated. My parents are vaccinated. My spouse is vaccinated. Oh, for God's sakes, get the shot. So, so it's a little frustrating from my standpoint in that, we're trying to figure out how to make a workaround for the fact that we really aren't taking advantage of the primary prevention strategy that we have before us. And that's just sad. I mean, it just is sad.
Any other comments? Ashley? There are some typos in here also that somebody needs to go through and take care of. In reading through it, I found several that could make things a little even more confusing to people. Any other discussion or comments? Everyone understands this is a potential. It's not a requirement that we're doing. We have the ability, we'll do a vote on it later. We will be voting whether to adopt it or not adopt it. All right. Ashley, thank you for the presentation. Gary, are you doing surplus equipment or?
No.
Nope. No, Jamie is. Sorry. I see that.
Hi there. Can you hear me okay?
There you are, Jamie.
So switching gears. So similar to what other nonprofit accounting organizations have in place, we need to have an update on the process that allows us to take the equipment that we have purchased but no longer need, to be able to dispose of that in a way that is as practical as can be. And so that looks like for us, having equipment that we think still has value, making sure that we're going through a bidding process for that. And then if equipment still has value, before disposing of it, which means trashing it, we would donate that to a nonprofit organization. And so we have a procedure that was written in 2012. That's basically when we moved to the new building. So it's a decade old. When we were looking through the procedure, we noticed that there's some updates that are needed, and that there's 2 items that we need board input on to make the improvements. So we submitted our procedure that we use internally to process disposal of surplus equipment. So there's 2 areas that were submitted and recommended for a change. The first is regarding updating the definition of value of surplus equipment, and then also setting a value for what that looks like, not only to go to a bidding process that would require quite a bit of staff time, but also then that would need to go to the board for approval on. And so setting those 2 values. And then we submitted some additional language that's just updating some of our language regarding grant and contract, disposal of equipment for them, and then basically just basic disposal guideline information. So the first recommendation that was submitted is to accept a definition for the letter A that you see from the accounting manual is what was submitted, just to provide a definition of what we're calling surplus equipment. This is basically just marrying up our current accounting policy with this definition. So that would be one area. The second area that I think probably needs some discussion and definitely needs some eyes and thought put to it is we wanted some more guidance on what the value assessments thresholds could be. And so what was proposed was based on a review of like Clay County's accounting policies, the state's accounting policies, and a couple of other local, I think, universities for the information that we could find online. But similar to state rules, was proposing that if we did have equipment that we're no longer using, that we need to dispose of, whether that's selling or donating, that we set that limit at $1,000 for our bid required. And we also suggested, which is totally up to board decision, that if we have a piece of equipment that would be $2,500 or greater, that we would bring that to the board, similar to how we do our RFPs. And then the other small edits were in there as kind of a recommendation for that additional language. So that is the kind of a general overview of what we're looking at for that. Is there any discussion on the definition or the value?
So as I put in my report, the reason why normally the management team is responsible for SOPs, but because the Board of Trustees are the trustees for the property, and this involves property, this is why it was brought to the board.
Amy, what was the prior procedure? Have you ever tried, like, rather than donating, selling this on like the government surplus website or the government surplus areas, or what was done in the past, you know?
No, we are aware of those though. So yes, we would do that. We're kind of in a situation now where we've had storage space to be able to store items, but we no longer can do that. And so we went through a large inventory process in 2019, which kind of shed light on some of that stuff. And so we just kind of started taking it on as a big project. And that's when we looked at this and did go, oh, okay, now it's time that we need to go through those processes. So no, it is on our radar, but we haven't used it yet.
And is that something that rather than just donating everything, if there's really value to this, $1,000 or so in that ballpark, is that an option that you guys would then exercise, is to try to sell it out on a government surplus exchange or whatever?
I think it's an option, yeah.
Okay, so this isn't just like, hey, you're going to donate everything.
No, we haven't used this procedure. We just kind of left that part as is.
Okay.
Yep.
Thank you for the clarification.
Sure.
Years ago,
Jamie.
we had some excess equipment that we no longer were using, and we looked into the state. They have a warehouse or some kind of an area where they will sometimes buy stuff, or they will even sell excess things to other people. At that time, and I don't remember what it was we had that was extra. It worked out that we didn't do anything with them, but those types of agencies are out there. And I think we ended up donating some things to an agency rather than going through a selling process, because that was not going to work for us at the time.
Well, and that's why we were trying to get.
That's been years ago.
Oh, sorry. That's why we were hoping, if we could put a threshold on it, it would certainly help us kind of make these decisions and feel like we're not letting go without, feeling like we're in a hoarding situation.
I like the idea.
Okay.
Dr. Gates has his hand up.
Dr. Gates?
Yeah, Jamie, yes, thank you. Jamie, I think that's a good idea, to put, for things less than 1,000, for over than 1,000. I think it's good to keep the document without a policy or procedure as far as what we do when it's over 1,000, because, there's a number of things as mentioned before. You could donate it, you could list it on one of the state situations. I've seen some governmental agencies do auctions. I know when I went to Penn State each year, they would have an auction of all these items that they didn't use, and it would be a rather well-attended auction. And so I think there's a variety of ways that this could be done, and by not putting it in there, it kind of leaves it open for discretion about where we think the best place for these pieces of equipment would go to.
Okay. Thank you.
Board members, any other discussion on the amount, whether 1,000 or is 1,000 enough, or 2,500? What do you think?
I'm okay with 1,000.
Thank you, Dr. Gates. All right, Jamie, I don't hear any other questions for you. Thank you for presenting that. We'll vote on that later, and we'll define for you the parameters, okay? Jamie, you're also doing the HVAC maintenance and service recommendation?
I am.
You're lucky tonight.
I know. Still staying on that facilities theme. We do our RFP process when we meet that threshold that's outlined in the board bylaws for our purchases. We do the RFP process, and it's mostly for a lot of facility services. And so we did an extension on our last contract of 3 years, which made it 4 years. And so we have submitted a recommendation for HVAC maintenance and service. This does not mean if we had equipment to replace that we would automatically go with that vendor. It's strictly for maintenance and repairs. We're making a recommendation to you to accept Lippert Mechanical for our next 3-year contract. In the review process, we received 6 proposals. Just like with every other RFP, we use a scoring matrix based on certain factors. And so we have minimum requirements that are outlined as well in terms of how many years the business has been in operation. Are they located within, a certain mile radius? What kind of other service do they provide, customer service, those kinds of things. And so we went through that process with the proposals that we received. And we would like to make a change from U.S. Engineering to Lippert Mechanical for this next 3-year contract, largely based on what they submitted, not only meeting the requirements, but also scoring high based on the cost, based on the anticipated cost if we had repairs, and then what we think in terms of quality and partnership that we need when we implement a new automated control system for the HVAC equipment.
Okay. All right, any questions for Jamie? All right, hearing none. Jamie, we'll vote on that in a little bit.
Okay.
Thank you for the presentation.
Thank you.
Treasurer's report. Courtney?
Hello, everyone. Okay, you got the financial statements in your board packet. I can walk through it if you need to. On the combined, our general fund has $7,829,570. Our capital renewal fund, $404,420. Our total is $8,296,991. Does anybody have any questions about the combined balance sheet? Okay. And looking over the combined income statement, does anyone have any questions about that? Okay. General fund income statement. Any questions there? All right, and then our capital fund income statement. Okay, so everything reconciled with the cash accounts. You can see the register. There's the check voucher register. Any questions over those? Okay. Some notes. Revenue for August was $207,893. Year to date, the revenue is $7,488,601. We have received approximately 83% of the budgeted revenue. Expenses for June were $682,300. The year-to-date expenses are $7,658,222. We have spent approximately 85% of the budgeted expenses. COVID-related expenses have caused medical, professional, and contracted service, janitorial, and rent expenses to be higher than budget. Consistent with previous months that we've had here, so. Any questions over that? It doesn't look like we have any investments maturing, but it looks like next month there will be several. And those are highlighted for you on the investments. Okay, anybody have any questions?
Thank you, Courtney. If there's no questions for Courtney, I need a motion to accept the October 2021 financial statement as presented.
So moved.
Second.
Any questions or discussion on the financial statement? Hearing none. All those in favor?
Aye.
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 Opposed? Now I need a motion for to accept the October 2021 schedule of investments.
So moved.
Second.
Questions or discussion? All those in favor?
Aye.
Aye.
Aye. Opposed? Need a motion to accept the consent agenda as presented?
Motion to approve consent agenda.
I'll second.
All those in favor?
Aye.
Aye.
Opposed? New business. All right, now we need the vote on either to approve the test to stay option for school guidance or not to approve. Does someone want to make a motion? Go ahead, Kathy.
Dr. Gates.
Okay, I make a motion not to approve the document as written.
Second. Read my mind.
All right. Any more discussion? I guess clarification, if we do not accept this, the schools still have 3 options for what they're doing with potential COVID cases. So they are still covered as far as their processes and procedures. Kathy, I guess the question would be, if we do not pass this, is it going to make it harder for the schools, or will it make it easier for the schools to, be able to go ahead with the other 3 options?
Yeah. Now I see it as more clarity and less confusion and more consistency. And yeah, it's just logistically not possible. It's hard, very difficult.
Any other questions or discussion from anyone? Courtney or Dr. Purdom?
Yeah, I rely heavily, like I've said in the past, on our health experts that are on the board. And I mean, Kathy knows more than anybody does because she's in that position. And so, I really trust what you're telling us.
You're comfortable with that?
Mm-hmm.
Okay, good. Dr. Purdom, do you have any concerns?
No, I think adding a 4th option to the mix, given how our county is very different from Kansas City. I mean, we have very rural communities as well as urban, so it's a little bit of a stretch, I think. Just procedurally, do we move to bring this for a vote and then vote yes or no? Is that how we have to handle the question?
Well,
Yes,
we have
there's
to approve it, or we have to say, no, we're not going to approve it. So it is sort of a yes or no. Gary, am I correct on that?
Yeah, well, you are, but there's also been a motion and a second on the floor already, so you have to vote on that motion.
Right, we have to vote on that. Right. All right, so the motion is to not approve the test to stay option for the school guidance. All those in favor?
Of the motion of not supporting, aye.
Right. The motion is to not approve it. All right. Sounds like everybody says aye. Anyone not in favor of that?
I think it was
All right,
unanimous.
hearing none. Yep, unanimous that we are not approving the test to stay option for school guidance. Next, we will vote on the SOP for disposal of surplus equipment.
I move that we approve the SOP for disposal of surplus equipment.
I second.
All right, wait a minute.
Yeah, do I have to put a threshold?
We have to clarify the amounts, so do that with it.
with the $1,000 threshold.
Okay. So your motion is to approve the SOP for disposing of surplus equipment and to define the value at no less than $1,000.
So moved.
Need a second on that?
Oh, I'll second it, sure.
All right, discussion. Is everybody comfortable with $1,000 as the minimum? All right, hearing no questions or discussion. All those in favor?
Aye.
Opposed? All right. And Gary, would you please make sure that for the January meeting, when we do the bylaws, that we look at putting this, the board's role for this procedure in the bylaws? Gary?
Yes, I was writing it down, sorry.
Oh, okay. I wasn't sure if we'd lost you. All right, thank you. Now I need a vote to approve the recommendation for Lippert Mechanical to do the HVAC maintenance and service contract.
Motion to approve.
Second.
Any questions or discussion? All those in favor?
Aye.
Aye.
Opposed? All right, Daryl, monthly report.
No, you need item D.
Oh, sorry. I just marked that off. Sorry. We need a motion to continue the use of emergency reserves for COVID activities, please.
So move.
I'll second.
Any questions or discussion on that?
Yeah, how is our spending looking at that, Gary? One of the reasons we've got this on the calendar is just to kind of keep a tab on that spending.
Yep, so accumulated expense to emergency reserves as of September is $139,631.73. So that's where we're at currently. Well, let me rephrase that. Sorry, I should have flipped the page over. As of October, it's $144,635.30 that has been accumulated to the emergency reserve.
Do you have a sense of how that's going to flow between? I mean, I know we're seeing an uptick in cases in Clay County with COVID. I know that Northwest Missouri is seeing a particularly uncomfortable hotspot right now, up in Maryville particularly. So do you have any sense of with the being in the pandemic as we are we sort of in a steady state? It's going to just take a certain amount of cash to keep this response going. Do you see us increasing? I mean, is it impossible to predict that? I guess those are my questions.
Okay.
At least you gave him multiple choice.
Yeah.
Yeah. So there's as you know, there's a number of factors at play here. So and yeah, it's impossible to predict, but we have, and I'm going to talk about this to some degree in my report when I show you the COVID numbers. But we have been experiencing a plateau after this big drop off from earlier, but that plateau is significantly higher than the plateau that we experienced pre-Delta. And we have also been seeing a slight uptick in the last few weeks. The website was updated today, and I will show you that. And there was a significant jump today with COVID cases. And I'll go into that. So when I show you on the screen later, but we've applied for ARPA funds. Currently that we've been told that's on hold for us from the county commission. So as you also know, the significant majority of our ability to respond in this pandemic was funded through the CARES Act, and we've set up our infrastructure accordingly. And so Penny's done a great job, as well as staff throughout this year, utilizing existing resources, finding new resources, which has kept the impact on the emergency reserve fund much lower than what we anticipated in the beginning of the year. And so, you know, shout out to her for that work. But if we don't get the ARPA funds and we have a third wave, or even a moderately significant increase over the next couple of months, it's going to be pretty impactful. And we would see a because we don't have any other opportunities or options at this point other than the emergency reserve, we would see a bigger dig into that fund.
Okay.
Is there
But
something?
again, you know,
Do we
one
know
day,
why?
as you know, every day's a new day, and so I do not predict. I learned that a long time ago in this pandemic, and so who knows what's lies ahead. I'm a little concerned about what's starting to pop right now, but that could change tomorrow.
Is there something to
Garrett, do we know why we've been put on hold?
Yeah.
Okay, I think I had two people ask at once, so
Yeah.
I didn't
It's
get
probably the same question.
Yeah.
Do you know why the commission has put our funds on hold?
We were told that they wanted more information, and so we've provided that information, and they wanted to move it to a business session, a future business session meeting of the commission, and they just haven't done that yet.
Okay. All right. Thank you.
My question to tag on to that, is there something we can do as a board to help encourage them to go ahead and provide that funding like they did last year?
Yes, you can reach out to them.
Okay.
I would encourage that, actually.
Okay.
And do it to all three, not just one.
Would you be able to supply the email, the contact information for those three?
Sure.
So that we have consistency in our.
Yep.
Thanks, Kathy.
Thanks.
Gary, could you
Yes.
Maybe send a paragraph explaining where that funding is coming from, just so that we could very intelligibly describe the request to them?
Sure.
Thank you.
Yep.
And also maybe if you have some data, how the funding they provided last year was utilized, or something that we could also intelligibly point to to make the need dire, like we have a dire need here to continue to protect our community and provide those resources. And so if you have anything that speaks to that, you know.
Yeah, I've already shared a lot of information specific to that with them when they first said we want more information. So, and as a matter of fact, the county auditor even commented how well the health department utilized those resources in that particular meeting, which I found interesting. So, but yes, I can send that.
Yeah,
And
that would
they
be
have
great.
they have paid us some funds from that, have they not?
Nope, not
Last
from
year.
ARPA. From
None at all.
CARES Act. From CARES Act, we
CARES
did get.
Act.
And that, okay, so we might start by being very, thanking them for the help that they
Mhm.
provided through the CARES Act, and that we would like
Yeah,
to.
that's already been. I did that as already. Yes.
And
Yeah, we
let them
can do
know
that.
what we did with the CARES Act money, and I think that would be a good way to start, to say we utilized your CARES Act money and for these good purposes, and now we've done these other things, and we'd like to receive reimbursement for those. I think that.
That's basically my presentation, Dr. Gates.
Okay. All right. Well, thank you then.
Yeah, sure. But I'll forward what we're talking about, so you'll have a copy.
Mhm. It just seems hard to believe that any government entity would be expected to use their emergency reserves in that manner. I just don't understand that logic, so I don't understand why there's a roadblock there. But
Yeah.
it's
They have to
unfortunate.
open the storage unit up to an auction.
Yeah. Right.
All right, do I have a motion and a second then to continue the emergency reserves? Did I already get that?
I think Dr. Purdom made the motion.
Motion.
And I-
Motion, did he say second? You second?
I
Good.
think so.
Any other discussion? Comments? All those in favor?
Aye.
All right.
Aye. Opposed? All right, Daryl. Your report.
All right, I'm gonna pull up, share my screen here. Popping up for everyone.
Mm-hmm.
Okay, so you got my report in front of you. I'm going to go down to page 2, I believe. Yep. So, we have been Facebook live streaming our board meetings the last few months, and so I just wanted to kind of give you just a breakdown on kind of the length of last month's board meeting, but then also how many views we got. So we are getting quite a bit of outreach on maybe not those that are viewing it live, but you can also go back and watch it after the fact too. So Kelsey's able to pull those numbers there. So getting a lot more exposure from our board meetings in the virtual format. So that's a good thing. I'm going to scroll down to page 4 here. So one of the ways that we are trying to supplement, all of our funding sources, the CDC Foundation, they started providing a no-cost temporary contracted surge staff through DHSS, and so they're hired by CDC Foundation. They're funneled through state of Missouri, and then we're able to request certain positions. So we've requested some disease case investigators and epidemiologists, and potentially a communications specialist to help supplement some of those items. And so those are currently funded if we get them through July 31st of 2022. So again, it's a short-term solution to a staffing problem. But again, they would not be our employees. We would provide equipment so they could communicate with our staff and be within our systems. But we would not be responsible for any of their labor costs. So that's one thing that we're continuing to look for. On page 5 in accounting, so we did implement the vaccine incentive program. So those are the gift cards for Clay County residents that come to our health department and get the vaccine. And so it's been well received. Obviously, when we opened up the younger age group, we've gotten some more those gift cards given away as well. So we've got another batch ordered that carries through the end of the year. And we just had a planning session today on that topic as well. So not very many health departments across the state are doing that program. So, you know, it's a little bit cumbersome. Staff have done a great job adapting to that. But it is have a couple extra more challenging steps for our staff. But we'll continue to do that until we get rid of those cards and get those out in the community. So especially during the times of the holidays, that little extra money is very helpful for families. Also, another way that we're trying to enhance getting grants and funding. So we signed a 2-year contract. It's a ELC expansion contract. So that's $70,000 to assist with COVID response. So again, we're able to funnel in, whether that's disease case investigator salaries or epidemiologist salaries, a number of different things fit under that program that we're able to not use our budgeted item, our budgeted revenue for that purpose. On the IT front, so Jason Shoemaker, he's done a great job implementing the multi-factor authentication logins, and so that is for remote access on our 365 platforms as well. It just helps. It was one of the things that our insurance company required us for our cyber security policy. Jason and Tree were able to act quickly and get that identified and implemented as well. So I know it was just one extra thing on their plate recently, but they did a great job getting that squared away for everybody. Again, I always touch base on the vital records revenue. So again, we're above our budget revenue projections for 2021 in vital records revenue. We did for our draft budget for that will be in front of you next month. We did bump that up, that revenue projection up for next year. Still a little bit conservative because you never know what vital records revenue is going to necessarily do. But we looked back a couple of years on that revenue stream, and we felt that we could bump it up a little bit more. I can't remember if it's 230,000 or 235,000. I can't remember, but that is in that draft budget for you guys. Going down to page 7. So I just wanted to highlight some of our health equity work. So we have a health equity subcommittee. So they're now a standalone committee. And so they developed a charter for what the committee looks like, the things that they identify and do for internal processes. And then one of the things that they did a whole lot of work on was the LGBTQ healthcare Bill of Rights. And so that was an SOP, and it just helps bring more equity within our walls and some of our processes and our forms. They had a timeline for some things to implement, such as changes to our EHR that are not maybe gender specific, very inclusive statements and things like that. So a lot of great work there. Another thing that we're doing on the health equity front, you'll see this coming down. We are changing our community development program manager position. We're going to change that title to a health equity program manager, and we're going to put health equity and health policy under that in that job description, and that's going to help trickle down into our community development specialist as well. So we're really trying to infuse health equity within our organization, and then also on that program manager front, they would be responsible for our external health equity initiatives as well. So really trying to stretch our capacity in health equity. Scrolling down to page 10. So Heart to Heart International, we talk about them a lot. They're continuing to vaccinate the vulnerable and diverse populations in our community, the hard to reach folks when they can. So I just want to continue to identify that. We're doing everything we can to reach the underserved. On page 11, we are looking at, we'll be going through strategic planning next year, and we're looking at other ways to improve our performance management capabilities and our reporting. So did a demo for our quality improvement activities for our new dashboard. Looks pretty promising. But again, we would go out to, if that goes past our thresholds, we would go out to bid on that. But just doing some early work to take a look at how we can kind of show that data better, not only for our internal processes, but to communicate with you all on how we're meeting our initiatives. In the world of environmental health, they're doing great. They are, I think they will just meet all of our scheduled inspections for the year, or just come right underneath it. We have some staff that are going to be out over the holiday season with some travel and some other things going on. So staffing will be a little bit shorter in November and the rest of November and into December. So they have recovered very well, being out, getting out to all of the restaurants. And you can see it in the priority violations. You know, they continue to drop down. So we're getting that education out there. We're getting the health interventions implemented in those restaurants so the public doesn't get sick. So they're out there doing a great job on the environmental health front, not only on the food inspections, but also on-site sewage and hotel inspections and things like that. Let's see. Scrolling down to page 18. So these are old numbers already, because this report was sent to you a couple of weeks ago. And so within our internal COVID clinics, we vaccinated just over 5,100 clients. And then we continue, like I said, to vaccinate some homebound individuals. Those folks were through the emergency response and our fire departments and our partnerships there. They go out and identify homebound individuals. They'll take the vaccine out, give them the vaccine, stay with them on the monitoring process, and then come back for their second dose if needed. Again, getting back out into the schools, our team's doing a great job there. So gave 257 vaccines administered in the school clinics. And so those were just the normal vaccine clinics that we do in the school. That was not a COVID vaccine clinic. Extra work too. So kind of our outreach to pediatric physicians in the Northland here. So before the 5 to 11-year-olds vaccine got approved, our team did a lot of outreach and provided technical assistance to get those providers enrolled, answer any questions they had, and then we have transferred some vaccine on the back end of those processes as well. So definitely wanted to fill that gap and get as many providers signed up to provide those vaccines before they were even available. I have one more thing. Two more. Yeah, so in the WIC areas, I think I mentioned this before, but the federal budget, there was an extension of the federal WIC budget that provided some extra funding for fruits and vegetables through 2021. There are still hopes to extend that through September of 2022. It's just been a really great benefit for our WIC families. And so hopefully that will be continued. We're also doing a ton of outreach in WIC. We have a new initiative, potentially our new partner that we may be able to do some remote WIC clinics out there and reach a lot of families. So that's really, really promising. So we're working on those details, and hopefully by next month, I'll be able to report on that, or maybe in January as well. So more to come. I thought I had one more thing here because I labeled it differently. Yep, this is it. So also on our STD front, so during October, our STD clinic continued to see clients Monday through Thursday. Right now, we are working on getting another STD nurse in on that front. Jackie gave her notice the other day, so she's got about a week and a half left with us, and so we're going to go ahead and fill that spot. We are receiving, I think we heard that Jackson County doesn't have their STD clinic open right now. They are providing services, so we understand that we're receiving a lot of folks from Jackson County as well, but we continue to have capacity even in the transition from Jackie to whoever replaces her. We have some other staff that can step in, so we won't lose capacity in that front at all. Just wanted to identify that transition is happening. So does anybody have any questions?
Any questions for Daryl?
Daryl, I just have, go ahead, Courtney.
I'm sorry. I was just going to say that my grandmother was the first one to receive the homebound vaccine here in Excelsior, and how well that went. She loved being able to talk to those firefighters. And whenever she found out they were hanging around for another 15 minutes, she was thrilled. So thanks for doing that.
How wonderful.
Well, they do a great job. We've got some MOUs with multiple fire departments and EMS teams around our community. So they're doing all the work. We just made sure that we had the MOU in place to make sure that they could get the vaccine.
Yeah, thanks.
And the only other question I had was that, our nursing home population was hardest hit in the very beginning and very vulnerable. Are we, and the state sort of took responsibility for that? Is that continued to be a state responsibility?
I believe so. I know that we continue to be in contact with them if they need any resources, like we can be a bridge. But I'm pretty sure the state is still handling all of the nursing homes.
Yes.
Any other questions for Daryl? All right, Gary, you're next.
Okay, I have a couple of items in my report. The first one is the budget, which you have in your packet, and I'm going to screen share that here in a second. So let me find it. And there it is. Okay, do you see that?
Not yet.
Mm-hmm.
Oh, yeah.
There you go.
Yes.
Okay. All right, so this is the draft budget that's in your packet. Of course, this is just a brief presentation. You'll have the next month to review the document, and then, of course, reach out with any questions you may have, as well as then at the December meeting, feel free to bring any questions or comments at that meeting as well. So you got 30 days. Very quickly, we're looking at, and I'm not going to read the entire budget summary sheet. I'm not going to go line by line. I know you all can read. I'm just going to hit some high points. So our 2022 projected health levy tax is $4.969 million for 2022. And you'll see that's a little bit of an increase over last year, and that's attributable to all of the continuing construction and growth that occurs here in Clay County. We're pretty fortunate that things are going really well in Clay County. You'll see under the MOU and contract fees, $1.2 million, and I'm focusing on the revenue stream side of things right now. And then if you go down to permit fees, you'll see $420,437. Again, that's an increase because of all the growth that's occurring. As a matter of fact, I'm going to be, we have a conversation in environmental health tomorrow. I don't know if you all recall, but they actually have completed a hotel in Gladstone, and it's a Fairfield Inn, and we're continuing to see hotels and other businesses come to Clay County, and so with that growth comes more responsibility for the environmental health program. So you'll see an increase in that area as well. Fund balance appropriation, you'll see 813,862 for a and the transfer into capital renewal fund. We're going to be recommending fully funding the capital renewal fund this year, and that's a good thing. We've got some aging issues. November 1st of this year was our 14th year in this building, and so there are things that for Dr. Gates, I don't know that you know this information, but we put together our staff put together a schedule, life expectancy schedule, and estimate how much time is left on all of our equipment that we own and other property issues, and then how much it would cost to replace it. And that work helps us plan the capital renewal fund. And so we're gonna recommend funding that fully. We've got some big projects that we need to get taken care of. So you'll see that reflected on the revenue sheet. For the expense side of things, our most valuable asset, of course, are our employees. And so for 2022, we're budgeting 3.4 million in full-time, 219,000 in part-time. Our health and benefits, Daryl, I forgot how much we're projecting that to go up. Do you remember percentage-wise? I just don't have the ability to do the math right here.
I do not remember. I know we're always conservative. It's usually around 12%, just to be on the safe side.
Yeah. So that's 638,950. Then our Social Security FICA is 282,000, right at 283. Retirement plan 984,000. And then as you go down the rest of the expenditure sheet, you'll see things are pretty stabilized. The other contractual services is the other big change or jump, I guess, or however you want to look at it, increase. We're allocating 263,000 to the strategic plan because, as you are aware, our strategic plan is coming to an end, and we are now currently in the middle of a CHA, and will soon be developing the CHIP, and then we'll immediately start into the strategic planning process. So all of those things will come to fruition in the first half of 2022. So we've allocated monies to that process. Software agreements, you see a significant jump there compared to 2021. A big part of that is, and this goes back to capital renewal. We have an aging software system that controls all of our HVAC systems, and it needs replaced. It's starting to cause some issues for us, and so we've got that on the front burner. And I think that takes up the lion's share of that increase. Is that correct, Daryl?
Yeah, so there's one other thing. One of the grants that we got from the state of Missouri that came down gave us the ability. It's a three-year contract. I'm sorry, 3-year contract, and our EPI team was needing some surveillance software. So that specific surveillance software is very expensive to implement. After the implementation, then the annual costs aren't too horrible. But that is the other significant portion of that software agreement.
Okay, thank you. And so at the end of the day, revenue and expenditures. Oh, and by the way, you'll notice that we do not any longer have a debt service fund. Yay. And so the money that we have been paying down on the building was annualized into our budget every year. That is, as you know, we paid the building off earlier this year, and so that line goes away, which is fantastic news. And just as a reminder, we refinanced lower interest rates on that debt service fund in 2009 and saved the taxpayers about $400,000 in interest. And by paying off the debt service fund early, which we were able to do thanks to good fiscal stewardship by the management team and the board. By paying that off early, we saved another $300,000. So we've saved the taxpayers about $750,000 in interest charges on the building and the debt service fund. And very excited to report that And so anyway, that line is gone. And so you'll see at the very bottom that our balanced budget is for $8,654,096 for 2022. So you have that packet to now go through, and I look forward to any questions you may have. I will be providing you all with a budget summary as well. That it's a narrative that goes along with that. In the past, everybody, Dr. Gates, you recall you get a budget summary narrative. So Dr. Gates, there'll be one of those forthcoming here shortly. That'll match up with the actual Excel budget summary sheet that I just reviewed. So that's the draft. The draft version of the 2022 budget for your consideration, and that'll be an agenda item on the December meeting next month. All right. The next item in my report is a COVID update. And so let me go to that, and I promised that I would. All right, y'all see that?
Yep.
Yes.
Okay, good. So this is on our data hub on our website. This is the, as you know, this is available to the public. And it's a very comprehensive, the staff have just done a fantastic job of putting this website together and maintaining it. It's very, very informative. So I'm on the recovery data tab of the data hub, and I'll start with vaccinations. And so you can see here that we have 74% of the people 65 and up in Clay County have initiated at least one dose. So that's great news. Fully vaccinated in that category is 69. So that 69 will catch up to that 74 at some point. As you're probably quite aware, depending upon which vaccine you get, there's a 3 or 4 week gap between the first and second dose. And then you're not considered fully immunized until 2 weeks after that last dose. So these two numbers, they will not match. In terms of 12 and up, it's at 50% at least one dose, and fully vaccinated 46%. That's a concern. That's too low. I also want to show you, I don't have to show you, but I can read it. So I asked for the EPI staff to put together the total for all of Clay County. And this number is representative of 18 years and older. So all of Clay County, Kansas City, Missouri, Smithville, Kearney, Liberty, Excelsior Springs, Gladstone, all the everywhere else. This number I'm about to give you is everything in Clay County. So 64.7% over the age of 18 in Clay County now have initiated vaccination. We're almost at 60% completing vaccination. So we're inching closer and closer to where we want to be. We're still a ways away, and this is just going to continue to be a very slow crawl, incremental movement in terms of those numbers going up. Again, to recap, the public health system in Clay County is responsible for immunizing patients, not just the Clay County Health Department. So people are getting immunized at pharmacies, grocery stores, pediatrician offices, physician primary care practice offices, hospitals, the health department. It's all over. And we actually have on our website, you can click on a link that shows every place in Clay County where you can currently get a COVID vaccination. So those numbers are inching in the right direction, but it's just going to take a while because we're not doing like an Operation Safe anymore, where we helped to put over almost 100,000 shots in arms earlier this year. So it's just going to take a while. The one thing I said I would get to an earlier question, I think was from Dr. Purdom. So if you can see my mouse on the screen, correct?
Yeah.
Okay. So this is what we've been experiencing so far. So you'll see a huge since the beginning of the pandemic, which was back in March of 2020, and then we had that horrible fall and winter. And this is pre-vaccine, which is important to note. And then in January, vaccine became available. And then as you can see, the cases significantly dropped to their one of the lowest points in the entire pandemic, which was March 28th, ironically enough, almost a year later. We were getting to seeing numbers that we had seen a year ago. So it was definitely a very good time frame. And then things plateaued. And then you'll notice around July, that's when the Delta variant reared its head, and you'll see a significant spike in the number of cases. And then you'll see that significantly decline as well. I want to point out, however, that we have been seeing a plateau, and that plateau for the last several weeks, if you'll notice, it's significantly higher with the Delta variant than the plateau right here prior to Delta. And so this just shows us that this variant is a lot more robust than the previous variant that went through the population. Plus, it shows the impact of vaccination has had in our community, amongst other mitigation measures. What's got us a little concerned is this plateau just started to inch up a little bit, and then here's the numbers from this week's report. And again, this gets updated once a week. So it's shot really significantly up in this last week. And that could be due to Halloween activities occurring, and people are also starting to come inside more, even though we've still had occasional days where it's in the 70s or whatever, but we're seeing more indoor activity. So this is something we're going to be keeping our eye on right here, because that's a little troubling to see that kind of a jump all of a sudden. And so we continue to strongly encourage vaccination and also wearing of masks. And in terms of the total cases, we're at about 30,000 now that we know of. And unfortunately, we're inching towards 500 deaths in Clay County due to this pandemic so far. Hospitalizations have been decreasing, but in the last 7 days, they've been increasing significantly, not to the point of creating diversion or those other capacity issues that hospitals were experiencing earlier in the year when Delta was at its peak. But we are seeing an increase in that. And we're seeing an increase in community outbreaks as well. We have multiple outbreaks in schools occurring right now, unfortunately. And so that's kind of the brief synopsis of COVID activity. In terms of our vaccination clinics, Daryl already referred to one. We're working with all the schools, and we've been partnering and providing vaccination opportunities with our schools as well as other community providers. And you would think that it's interesting. The 5 to 11-year-olds, once that became available, and we started opening up those clinics, you would have thought the Rolling Stones were playing at the Clay County Public Health Center, because those appointments were gobbled up within hours. Every time we open them up, bam, they get immediately filled. And so I know that 4 of the 5 large pediatrician offices, we've been working with them, and they are now vaccinating their patients. And so that's also something that we expect to continue for the foreseeable future. The schools have been great partners with us in that. Heart to Heart International, as Daryl pointed out in his report, has been going out and helping us, going out into communities. And like I said, our clinics have been just booked almost immediately. As soon as we open up a clinic, bam, it's sold out. So I expect that trend to, and so far it's that way, and I expect it to be the same. You know, at the very beginning, there's pent-up demand, and the vaccine becomes available, and then everybody who's been wanting one gets it, and then it starts to wane. I'm guessing that the children in the 5 to 11-year-old who got vaccinated and want to be vaccinated. So I'll expect that once we hit that saturation threshold, I'll expect that to also kind of decline and plateau. There's been a quote unquote a playbook developed for the vaccine concerned or vaccine hesitant. They don't want us to use vaccine hesitant anymore. It's vaccine concerned. And so we're going to be setting down and developing plans to reach that percentage of the population. In Missouri, that particular, oh, I shut everything down, didn't I? Never mind. I happen to know the percentage. The percentage in Missouri for vaccine, I'm sorry, hesitant, is about 12% in Clay County. You can actually, the state's got a website where you can just hover over the county with your mouse and it'll tell you what the percentage of the people. I'm not really sure how they calculate that. So we're really going to be targeting that group. There's the rest of the percentage of people are like, they're the ones that are like, no dice, no way, no how. They're not getting vaccinated. So we're not gonna spend our time on those folks. And I think we all know who they are. They've been pretty vocal at our meetings and either to you or to me for the last 18, 19 months. So we're going to be developing plays off of that playbook and implementing those as well. It's not as simple as it may sound. Vaccine hesitancy is very complex. There are multiple categories where people fall into, and it's all outlined in this playbook. And so you have to adopt your strategies depending upon what category you're trying to target. And so we'll be doing that as well. And we don't have any members. Did all the members of the public drop off our call?
Daryl,
I'm looking now. I think they did. We still have members on the Facebook stream though.
Okay. So I'll be happy to entertain any questions about the COVID report or the budget presentation. And I do have a couple of things, a couple of other issues coming up. Or
any questions for Gary?
okay, hearing none. In Gladstone, there is a TIF project coming up. They are building a 220 unit apartment complex with 9,000 square foot retail center adjacent to North Oak Traffic Way. The cost of that project is $35.3 million. And so we've been sent the abatement figures, and If you want to know what that will amount to for us, just let me know. Another big project, the Ford Motor Company, they're expanding their stamping plant in Liberty again. And so this is a $7 million addition. And I think everybody knows where that stamping plant is. It's right behind the Clay Como plant here in Liberty. Excuse me, the stamping plant is in Liberty. The Clay Como plant obviously is in Clay Como. And so I just wanted to let you know those two projects will also be coming up, and that will add to the TIF money that we lose to health levy tax.
Gary,
so-
is the library still representing us on that?
Say again, sorry?
Is the library still
Yes,
representing us
Potter.
on that?
Steve Potter.
All right, any questions? I have one reminder. You all received an email with an evaluation form in it for Gary. I was supposed to get those back. I've received one. So if you would please get those to me by a week from tomorrow, that'd be December the 3rd, so that we can present that on the agenda in December. I would appreciate it. If you have questions about that or you need the form again, please let me know. Gary, anything else?
No, ma'am, that's it.
All right, anything from anybody else?
Pat, I had a quick
Yes.
question about the going back to meeting in person. Should we put some thought into what it would take to get back in person? I would presume it would be getting the case index down to less than 100. Gary, is that?
That's been, yes, sir, that's been a guiding principle, and unfortunately, we just, right now, we've been in the high red, the high community transmission red since July. We've, like I just showed you, I really would like to, I'm curious now to see how the next couple of weeks go, because that was a big spike here. And it could be an anomaly, and then things go right back down. So, but yes, that's a big driver, community transmission, and we're still in the red.
Okay.
You also have Thanksgiving and Christmas coming up.
Yeah.
Yep. Thank you.
Yes, you're welcome.
Yeah, we're monitoring that, Dr. Gates. Thank you. All right, I need a motion then to adjourn at, what is it, 6:48, 7:48, 7:48.
So moved.
Second.
Second.
All those in favor?
Aye.
Aye.
All right, everybody have a wonderful Thanksgiving.
You too.
Yes, thank you, everyone. I'm
Bye.
the host with the most this year, so.
Hooray.
Happy
Bye.
Thanksgiving. Bye-bye.